This is Chris Lenois for WKVT Radio 100.3 FM and 1490 AM. Today we are proud to bring you another presentation of A Call to Action, our quarterly series of public forums focusing on critical issues for the greater Brattleboro area. The topic we've chosen today, teen suicide, is not an easy one to talk about, but along with my co-moderator Fish, we have a panel of guests that will hopefully help us raise awareness and offer resources for friends, family, and community members to prevent such a tragedy from occurring. We're broadcasting live from the meeting room at Brooks Memorial Library until 1 p.m. today. And as always, we are inviting members of the community to come in and listen, as well as participate in the discussion. This program is being recorded by Brattleboro Community Television for later airing on their cable channels and the BrattleboroTV.org website. We would also like to acknowledge Brattleboro Savings and Loan and Farnham Insulators as sponsors of our Call to Action forums.
One of the things that Chris and I often do is we'll kind of go over the topics that we want to discuss at these call to actions, things that we feel are prevalent in our society, things that really need some immediate attention. And this particular forum came to me via, honestly, of all things, television and Netflix and 13 Reasons Why. And it wasn't so much the series itself that bubbled this topic to the surface. It was kind of the aftermath and what I was reading and how many different people thought it was a great series and thought it was a detriment, and it was a visceral response either way you went, and which is what made me think that today's topic would probably need to kind of bring that to the surface to actually have an actionable conversation around this topic. Again, not an easy topic to discuss, but we want to thank our panelists. So why don't you introduce them?
Yeah, for the first hour, joining us here on the panel is Nicole Miller. She is a mental health program specialist at the Center for Health and Learning, and Ricky Davidson, the executive director of the Boys and Girls Club of Brattleboro. Appreciate you both coming in today.
Thanks, Chris.
Thank you.
And I guess let's just start by talking about this topic of teen suicide and how it relates to the work you do. I know at the Center for Health and Learning, Nicole, it's obviously very direct with some of the things that and specifically what you do there.
Yes, I specifically work with the Vermont Suicide Prevention Center, which is a program of the Center for Health and Learning. And we even have specifically a You Matter for youth and young adult programming that we've been working with youth through events and training and courses and curriculum, turning into a community action project from January through June of 2017. It is very important to us on promoting positive mental health and working upstream with youth before it does become a crisis of mental health and needing that intervention. But at the same time, those resources and intervention is necessary as well. So we take it as multi-pronged approach.
Yeah, and Ricky, I know the Boys and Girls Club slogan, a positive place for kids, and so obviously that is the goal there. But I imagine too, it's also a place where some young people look at as a safe space, and possibly these issues come up there at the Boys and Girls Club.
Definitely. I mean, over the years, we've had kids that have come to us and come to staff because they feel like we're the person they can confide in when they're having some of these feelings and some of the ideas and kind of getting to that crisis stage. Before they get to the crisis stage, like Nicole was talking about, they use us as the place of, well, okay, what can I do? I'm feeling this way and I need to do something about it, or I'm scared, or I'm whatever. And we kind of walk them through that and then help them connect them to resources in the community. Yeah. Which is wonderful that we have so many resources in the community to connect them to. Yeah,
and that is the goal of these forums, is to make people aware of some of those resources, possibly meet people, as is happening today already with some of the organizations that we're bringing together in the room. And if anybody who is here in the meeting room at Brooks Memorial Library, there is an audience mic if you have any comments you want to make or any questions that our panel can react to. Before we get to that, though, right before we came on the air, Nicole handed us this recommendations for talking about the topic of teen suicide today. And obviously, I think this is a really important way to start the conversation around some of the rules and some of the things that we should be sensitive about when we're talking about this topic, Nicole.
Yes, absolutely. And this is a national publication. And as you read many of the national print on suicide, I think everybody that is reporting within the media continues to need some guidance and recommendations. Some of those recommendations are not to sensationalize with headlines, for example, on suicide, not to broadcast it as an epidemic and skyrocketing, but instead, we want to share the data and share exactly what happened rather than sensationalizing it. Another key important piece is the language that we're using. And this is actually coming from survivors of suicide loss. So a family member who has had somebody who has died by suicide. That's the language that they're asking you to use, died by suicide, rather than committed, because that's referring to committed a crime. And that adds to the stigma with mental health. And we don't want to reinforce that, as well as that it's not successful or not an unsuccessful suicide. We don't want to use that language and put that judgment on it. We just want to talk directly about a death by suicide, died by suicide, attempted suicide. And I think in general, as we're talking about suicide and trying to combat this stigma, I know the Brattleboro Retreat has a huge campaign on this, combating the stigma of mental health. It helps to talk directly about what you're talking about rather than kind of skirting around it. And suicide is a very complex issue. So it's not just one thing that has ever caused somebody to die by suicide, regardless of that coming right before it. And we always want to offer hope and offer resources anytime we are talking about it. If anyone does ask questions, when they're asking questions, please don't talk specifically about somebody who died and give any of that, personal information.
Yeah, and that's one of the reasons we invited people who are part of organizations here to address these things, and I hope you'll keep us on point throughout the conversation today on some of these things.
But Nicole, can I just ask a question? And I think that was one of the bigger things that I had seen as I was reading and the reviews on and I'll refer back to the series a lot because it is what motivated and brought us here today.
I assumed.
Did you see it? Did you watch it?
I've watched all of it. Yes.
Yeah. And one of and somebody actually used the scariest thing that they could say about this entire series, 13 Reasons Why, was that it almost glorified it.
Yes.
That a person who is in that dark place at that point in time thought this out, premeditated over a long period of time, listing it out, and then it gets executed as almost exactly as they would want it executed, as far as the plan goes to kind of show those people. Now, do you find would that be a problem that you would have with something like that?
Yes. Not that I'm here to totally talk negatively about the episode or about Netflix, but the majority of these guidelines were not followed in 13 Reasons Why, with memorializing, with glorifying. For example, in the locker room that she's memorialized and students are coming and taking photos and things like that. That is not necessarily realistically what happens, and we don't want youth to think that they will be, if they are hurting so much right now and they think that it will be better after they're dying. That is not reality, and that is not what we want it portrayed as, that they will be forever memorialized. That is a big against the guidelines.
Well, and just as I briefly, I took a few, about a minute to kind of look over this, and as I was applying it, it was interesting to see like a lot of these rules. Of course, it's Hollywood,
yes,
so they'll do whatever they can to get theirs done. We understand that. But I also thought to argue for the series, that it just, the things that teenagers can do that us as adults and people out in the community should be looking for are the things that brought that particular character to this place to do this. I thought that those were the important things that I don't know how you make kids understand or have adults look out for it and take it seriously to make the behavior stop.
Well, I think
yes,
one of the
please.
things that was great is about that series that was really helpful for us is at the club is it was a conversation starter.
Yeah.
We had the conversations with teens in the club about it because they were all watching it. or they were talking about it if they weren't watching it, and if they missed one section, oh, what about this? And so it was conversation starters, and we use those as teachable moments about the fact that this is not how it happens. This is not how it should be. This is not something that should be glorified. And for the most part, they understood that. They were like, they came to us a lot of times with questions about that. Do people really do that? And we were able to say no, they shouldn't do that, or they shouldn't glorify it, they shouldn't memorialize somebody, those kinds of things. And so it was really that conversation starter that was really helpful for us when that came up, because we could have this conversation and it was pertinent to them in that moment. Yeah, and that was really helpful for the teens.
I think you're exactly right. That's kind of the two sides that you've been getting in the media, is teens that are doing relatively well in their own mental health and physical health are able to use this as a conversational piece and to go to an adult and ask for help. For those who were already struggling with their own personal health, a lot reported that the actual episodes were triggers. Yeah. So, I think it's there, it's available. Teens are watching it. So I want everybody to be using it in as much of a positive light as we can, take advantage of it, and have parents sitting with their youth watching it. It's intense. It is intense. Every single episode is intense.
No question.
So, I wouldn't want my child, for example, watching it by themselves, and be there for those conversational pieces. And if it isn't the parent, going back to, the Boys and Girls Club or whoever that safe individual is, to definitely be talking about it and not just letting it mill around in their head. And then the issue is for those that aren't talking about it and that it was triggers are scary. And that's, what we want is to be able to reach out to them and make sure there is somebody that they feel comfortable talking to. Right.
So, and when I watched the entire series, I thought to myself, it's semi-foolish and semi-reckless to produce a script like this that can show that any one person can prevent it, when it really is sort of a cavalcade, if you will, of different things that can happen. Yeah. I think we all as individuals can endure one thing and endure it well and can live to tell the story. But and the other main character in there, just thinking that he might have had an impact on that, I felt was a little reckless. Just that because if you use it takes a village model, yes. It really does.
It does.
To avoid these things.
And another analogy we use is an iceberg. Like, you're only seeing the tip of right. What's going on in a person's life, and a lot is under the water that you don't realize what is happening or what interactions they had and things like that.
Yeah, and we say a lot too. It's really important for everyone to be aware of. You don't know what happened with that person 10 minutes before or 10 minutes after you interacted with somebody, and you're catching them at maybe a really raw point or at a point where they're really struggling with for themselves. And if you're that person that's interacting with them, it's important to take that information and know that I don't know what happened 10 minutes ago.
Right.
I don't know what's going on in their head, but I need to be aware of the fact that my interaction could impact that.
We don't even do that as adults.
No.
And we need to we need to put that onto to teenagers, people that are that young who haven't quite got that processing skill yet, I believe. But it's so very true. We have no idea. You have no idea what happened to Chris and I on the way over here.
Right.
I mean, nothing happened, but you know what I'm saying? But you don't know that until we tell you.
Yep.
Well,
sorry.
No, please.
I think another thing is you're talking to professionals that deal a lot with youth and crises and things like that. But there's also the general public, maybe, of parents and community members that don't feel comfortable asking a youth that they are concerned about. And one of the myths out there is, if I ask, are you thinking about suicide, I'm actually suggesting it. And that is not true at all. And many of the professionals know that, but do many of the parents know that it's okay to ask my child, are you really low? Are you really depressed? Are you thinking about killing yourself? I want to get you help. And it's not that they have to be the one that provides the help, but they can get somebody to get them help. And I think a lot of adults don't realize that they need to reach out and that they can be the ones to ask and to intervene.
Well, and to that point, actually, a statistic I pulled from the Vermont Suicide Prevention Center website talking about depression among Vermont high school students. 19% reported feeling depressed for 2 weeks, and that duration of time fitting a definition of clinical depression. But at the same time, you're talking about teenagers, hormones, moods, dispositions, differentiating between those things for a parent, for a friend, or for a faculty member. How does one make those distinctions? Is it just talking to them? And
my feeling is they don't have to. They're not the professional. So if you're concerned enough with a youth, whether it's your child or a friend, that you're thinking about asking, then ask. Like, how, what's going on? I see a change in your mood. I see you really feeling low. I see you're not interested in the things you once loved. I'm concerned about you. And they don't need to know whether or not they're depressed or not. Like, they're not diagnosing the individual. They're just checking in because they care. It's the professional's duty to then determine what are the next procedures and where we go to get help.
yeah.
And I think one of the things that Nicole said before too is really important is that with these sensitive topics, whether it's suicide or anything else, a lot of people think that if they broach the subject with a teenager, that they're putting that idea in their head, and then they're going to go do it because I had that conversation with them. And that's not the case. In many cases, many teenagers, they have questions, they have concerns, they have thoughts about something, and they want to talk about it. And knowing that somebody cared enough to take that step might be the first step for them to take the next step to say, all right, yeah, I do want to talk about this. And maybe you're not the right person to talk to this about as a parent or something else, but then helping them get to a professional is important. So making sure that they're aware, that everybody's aware that if you're having that conversation with a young person, it doesn't mean that you're putting that idea in their head.
Right.
Because they have more ideas in their head at every minute of every day than we can even think about. And so that idea may have already crossed their mind. You talking about it might be the thing that get them to take that step forward to health.
I had an interesting conversation with an adult a few years ago, and the philosophy that is, and you'll pardon the phrase, "suck it up." It doesn't necessarily. It may have applied to me when I was growing up in the '70s and the early '80s. A lot of bad things happen. You could just suck it up, but there is just so many more ways to reach with smartphone and texting, and just ways that you could just punch behind a keyboard, if you would. I mean, if we had a problem in 1978, we settled it behind the bleachers, and it was done, and it was simple. And there were cases where you could be bullied, but it seemed like the adults in charge were a little bit more able to kind of leap in, break it up, if you would, just be a little bit more brutal to the person that was being brutal to make the behavior stop. I don't think we're there anymore. I think that everything has to be handled with kid leather gloves, and with cyberbullying, what that is now, you're able to, instead of just kind of ruin your reputation among 10 people, you're able to ruin your reputation among tens of thousands of people, and a lot faster. So I don't even know how this becomes unraveled and how you put it back together. So for you guys who are like the front line on this stuff, my hats are off to you, because we are dealing with a much different set of circumstances than we were years and years and years ago.
Yeah, I mean, one of the things that people often ask about, whether it's suicide or other teen issues, is it any different than when, 20 years ago, 30 years ago, 40 years ago? And I think that maybe the number of cases isn't necessarily different, but I think you're right. The social media is the thing, is the wild card that ramps everything up and makes it so much more intense. And next thing you know, people are getting criticisms and stuff from people they've never met, from people that are states or countries away.
Yeah.
And they're getting this criticism on social media that's just fueling, whether it's their depression or their feelings of self-loathing or whatever it is. And that's the game changer. And when I'm often talking to young people about, being careful about what they put out online and what does that look like, and doing that education piece, whether it's about any teen issues, because everybody and their brother has an opinion about that, and whether that's good or bad, they all do. And
I'm going to go with bad.
mostly bad, but people are constantly willing to chime in,
Yeah.
because everyone's got an opinion, and it's not always good.
I think we're off to a good start with this conversation. We are up on a commercial break right now, so we will take that, but then come back and continue our conversation with Nicole Miller from the Center for Health and Learning and Ricky Davidson of the Boys and Girls Club of Brattleboro. Call to action live from the meeting room at Brooks Memorial Library, talking about the topic of teen suicide. Back after this on WKVT. Welcome back to a Call to Action. Broadcasting live from the meeting room at Brooks Memorial Library, Chris Lenois and Fish moderating a panel on the topic of teen suicide. Nicole Miller from the Center for Health and Learning and Ricky Davidson from the Boys and Girls Club of Brattleboro with us here for the first hour. We're here until 1 o'clock today. Come on down to the Brooks Memorial Library if you have any questions. We have opportunities for audience members to ask questions of the panel or share thoughts. And if you are an organization out there that has resources or something to say, we always find this to be a great opportunity for people to meet people in the community who are doing a lot of the same work or maybe have questions about these things. And it's been a great place for people to get together and do those things. We do have somebody at the microphone right now who was in the audience who had a question. Tom, go ahead, sir.
May I ask how the statistics have changed over the years? I have in mind during the 60s, I became aware of a person who died by suicide who had to be a lawyer and an adult person. Mm-hmm. And I'm interested to know, since that time to now, how the numbers have changed with respect to the age groups, the demographics, locations, whether it happens more often in Brattleboro than in New York City, whether America is opposed to Sweden. Would that be information that you could provide us?
This is Nicole with the Vermont Suicide Prevention Center. That's a lot of stats right there in one question. One thing that I could say is that it is going up. The stats, in particular, as we're talking about youth today, are increasing. They're both increasing in our reports on the YRBS, the Youth Risk Behavior Survey that was mentioned earlier about youth reporting on their feelings of hopelessness for over 2 weeks, them actually hurting themselves, them having a suicide plan and attempting suicide. It is actually a very accurate reporting that Vermont has, several decades of reporting on. And those statistics have been increasing, and the death rates are increasing. Now, in particular, Vermont is higher and has, I'd almost say, always been higher than the national average of deaths by suicide. So, for example, for youth, now this is dated because it takes a while for the data to come out, and specifically taking out the youth. The last stat I had was 2013. But in Vermont, 14.5 per 100,000. This is age 15 to 24 years of age. And that's in comparison to the national average of 11.1. We're significantly higher in Vermont than the national average, and we always are. Vermont also is one of the highest New England states in particular. Now, there you had also asked about reasons as to, why some localities might be higher than others. In particular, states that are more rural are higher, and that's for several different reasons. Lack of connectedness and availability to access resources and mental health resources, whether it's a lack of public transportation, not enough resources, and also an increased access and use of firearms. So firearms is the leading cause for Vermont's suicides. And in particular, if I could share another stat, from ages 10 to 19 for 2015, the death by suicide for these teens, 59% used firearms. So it is what we highly promote is there's a free program online, counseling on access to lethal means. So it's not a situation that families should not have guns. It's more of a situation that what do we do with our firearms when we have a youth that we're concerned about? And how do we protect that youth? So it's really kind of the conversation of when we're concerned about an individual, how do we restrict their access to lethal means, whether it be a gun or pills or anything else? We want to limit that access. So just by having the accessibility of lethal means like a gun is more common in a higher percentage of hunting states. There's going to be more guns and more accessibility. So there's multiple different reasons, but like Montana and there's kind of along the Rocky Mountains are very, very high. They're higher than Vermont with rates of suicide, and it's much of the same reasons, with Vermont also being rural. To answer some of your statistical questions.
And there was,
Did you have a follow-up? Did you?
I could.
Yeah, absolutely, Tom.
If I assume from what you're saying that is the numbers or percentages of persons who die by suicide who are youth, teens or otherwise, has risen in relation to the whole or absolute numbers, can you describe why more of these actions are taken by youth as opposed to adults?
Youth are actually not the highest rate of an age group that is dying by suicide. Middle-aged men is the highest group rate. But I wouldn't actually be able to give a definitive answer as to why there is a rise. Nationally, everybody is concerned about that, and we're trying to address that. And one of the active ways, as I had mentioned earlier, was kind of working upstream and working on that prevention and working on before there's a crisis to see if that can help to alleviate the number of suicides and those getting to crisis. But I don't have, a one quick answer fix as to, stopping the rise of those dying by suicide, or that would be wonderful. And then we could fix the problem quite easily.
And I think, too, that going back to some of the things that Nicole said, too, about why the rise is happening, Vermont being a rural state, access to firearms, things like that, that's another place in which parents and other caregivers can really step in and be aware of that. If you're somebody that lives, in the outskirts and your teen is home alone a lot and things like that, that might be somebody that's experiencing some more signs of depression and being more aware of that. If there's firearms in the house and that your child has some issues with depression or mental health issues, that having those secured in some sort of a way to take those lethal means away is really important. So taking those steps, being aware of why the numbers are higher here than they are someplace else.
So Nicole did mention that the deaths by suicide on the national average are 11.1 per 100,000. Did I get that?
Yes, we do per 100,000 to compare.
And 14.5, almost 3.5 more per 100,000 in the state of Vermont.
And that was particularly youth.
Just youth.
Mm-hmm.
So armed with that statistic, Ricky, the work that you guys do at the Boys and Girls Club becomes just that much more important in heading this stuff off. So what do you tell parents when they come in and ask? I mean, there seems to be sort of, I think there are parents that are really connected versus the parents that just kind of maybe view you as a babysitting service.
Mm-hmm. Well, I think what we do is we try to be aware of all of the youth that come through our doors and what's going on for them, so that we can then access what the appropriate people are to talk to for them. And maybe it's a parent, maybe that young person has a counselor or somebody else that we can also be in touch with to help make that connection as well. And we have conversations with parents all the time about a lot of things that make young people unsafe, and having those forefront conversations. And, we go back to the Netflix show we were talking about earlier, is we broach those tough subjects, and I more times than not have parents thanking me and my staff for being the ones to broach that subject, because they don't know how to have that conversation. And we've had we're taking the first step of the hard part of the conversation, and then we can bring the parents into that part of the conversation, or letting the parents know, just so that you know, we had this conversation with your child. This is the stuff that they said to us. And they told us also that they see a therapist or they see a counselor. And this is something that needs to get passed to that person. And we're happy to help do that conversation. Or if you need to do it as the parent, you're doing it. But more times than not, the parents thank us for broaching those tough subjects.
Well, it does. I've often said a degree of separation brings you a little bit more clarity. You know, you're able to kind of see it without the emotion, without that kind of that personal fog that won't allow you to see it clearly. So folks like you and the work that you do at the Boys and Girls Club kind of bring that kind of clarity. When they get to Nicole or somebody else who will be on the panel today, I mean, I think that they've sort of kind of crossed over. And I think it's, honestly, I'm not blaming parents for the downfall of every child. I don't think that that's the case. But in a busy life and a busy schedule, sometimes this stuff is just written off. It's just teen angst. They'll get over it.
Well, and I think you're right. And I think a lot of times, too, it's hard to see the thing that's right in front of you. You know, and not because you're not paying attention, not because you don't care as a parent or a caregiver, but it's difficult to see that, to see somebody who might be struggling, you know, and something is it just hormonal teenage typical stuff, and when does it cross that line? And sometimes it's hard to know when you're living with it day in and day out as that caregiver that it crossed that line. And somebody, whether it's a teacher at a school or somebody at the Boys and Girls Club or someplace like that, we might be the ones that are saying, you know, we're really concerned about this because we think it's crossed the line, and we need to have that conversation.
And are you able to, in your position, once you identify that, do you actually maybe make a phone call to the high school and just say, hey, we're just going to we just want to put this particular kid just on a watch list. Let's pay attention.
Definitely, as part of our membership application forms, we ask for releases to be able to talk to the schools, so we can do that, talk to other people that maybe we need to talk to. And in many cases, I get phone calls at least a couple a week, probably, from mental health counselors and other folks that are involved in some of our youth lives that says, I have a release to talk to you, and I've been asked by the parents to talk to somebody there because they feel like their kid is not being forefront or not being honest or open with them as parents or with us as the therapist or the counselor. Can you shed any light on a situation? And we have those conversations all the time and have that back and forth communication, and we're happy to do that. I mean, we're glad that we're there to do that for them.
Okay.
Nicola, you had mentioned in your intro, talking a little bit about your organization, some of the outreach that you do. What was the name of the
You Matter Youth and Young Adults.
Right. When you go out into the community with this, are there certain settings that you find to be effective? If you go to a workplace and are talking to parents all at once about an issue like this, is that something that the You Matter program does?
Right. So I do want to clarify one thing, because we aren't direct service therapists, counselor, providers.
Right.
But we are a training organization and a resource organization. So we have curriculum and things like that. So I did just want to kind of clarify, as like our next participant with the Brattleboro retreat, they're a direct service provider with counseling and therapists. So I did just want to make that clarification. But for You Matter YYA, You Matter Youth and Young Adults, that can happen in a community setting with a group of youth or in schools. Both were participating. And again, it's about teaching youth that they can be a resource to their peers and giving them coping mechanisms and resources they can use themselves, like managing stress or a growth mindset versus a fixed mindset and those sort of things. So it's about teaching youth and giving them the skills and empowering them that they can make a difference in their community and with their peers.
It's just been interesting to me to hear from both of you and talking a lot about doing these things and having these conversations in groups. When I think about something very personal that's happening for somebody, to maybe having suicide ideation, and the idea of not wanting to share that with a large number of people. Where is that give and take on one-on-one conversation versus group conversation? Or maybe I have to have that notion disabused, right? It's not necessarily a situation where it needs to be one-on-one.
Well, I think especially for the teachable moments things that come from shows or other conversations that happen in the community or a news event or whatever, those teachable moments, when those come up, that's usually in a group setting. You're having that teachable moment with a group, and it's not personal. So sometimes for the young person, they are starting to feel like, okay, I'm not the only one that has this feeling. I'm not the only one that has this thought. I'm not the only one that's feeling this way. And then it might turn into after the fact, pulling me aside. Hey, Ricky, you were talking about this earlier. I feel like that sometimes. And so
it needs to come from
right. So it comes from a group where they feel comfortable with their peers, they feel safe in that group setting to get some information, and then the more personal stuff will happen more privately, one-on-one. So I think that it's sort of a two-step process in a lot of ways. There's a group conversation, that teachable moment, or a class, or a curriculum, and then it resonates with somebody on an individual level, and then they hopefully then reach out on an individual level and say, okay, this is real for me. And this is something that I need to be aware of for myself, and I need some help with.
Yeah.
And many times they feel even more comfortable talking to a peer. So it's empowering those peers to realize I can help them go get help. I don't have to have the answers even as a peer. So, out of that group setting, if there's another peer talking to another peer, then they would come to Ricky and say, help me help.
I was thinking that same thing.
Right.
Another, in terms of that network of somebody saying something to a peer, then that peer might approach an adult or somebody to try and, again, work on these resources. I also, when you were sharing some of those numbers and some of those reasons, Nicole, I couldn't help but notice that some of the reasons that you didn't mention were things like economics or other factors here. I mean, this is, when you're talking about an issue like this, we're talking about something that really is an issue that affects everybody or could affect everybody.
Yes, absolutely. I mean, there are certain risk factors or certain groups that do have additional pressures, and we would consider them high risk, but that's not going to be a reason to make somebody suicidal. So, for example, the pressures and the stress of homelessness could bring on additional resources because they're not going to have health insurance. They're not going to have the resources, and maybe, not being connected to different resources to help them and to provide the counseling and things like that. But that alone would not perpetuate suicide, for example. Another group is the LGBTQ community, and in particular for transgender youth in particular, if the family is not accepting of them, that's a huge factor of hopelessness. I'm not saying suicide, I'm just saying hopelessness. And only 35% of youth where their family is not accepting their gender identity have hope for the future. So if I can't even think positively about my future, then, that feeds into a lot of, of their mental health and their, positive outlook on life.
Right.
So it's complex.
Well, yeah.
Right.
And I mean, one of the other things that we haven't talked about yet, and I'm sure we talk about it with the next group of panelists, more substance abuse and the substance abuse disorder and how that plays into this factor as well.
Mm-hmm.
Yeah.
Well, and it's tricky when you're talking about any sort of mental health related issues because there are so many layers to it. It's not a one thing. It's, and it could be that somebody's struggling with some issues but they're dealing with it okay, and then one thing like homelessness comes up, or they're been self-medicating with street drugs and that's been working for a while, and then that stops working, and then you're adding a whole other level to that to the complication.
So I think we should maybe take a break, and then
Take
we'll
one more
close out.
break.
We'll close out this segment, and before we introduce our next panelists.
Okay, you are listening to Call to Action, a topic teen suicide, live from Brooks Memorial Library meeting room. Come on down. We are here until 1 o'clock. If you have questions for Nicole or Ricky, still a little time to ask them some questions, but we also want to give them a chance to talk a little bit more about some of the ways that they help make a positive difference in teens' lives here in our community. Chris and Fish on WKVT 100.3 FM and AM 1490. Chris Lenois and Fish back with you here at the meeting room in Brooks Memorial Library, bringing you a call to action on the topic of teen suicide here until 1 o'clock today. Once again, we'd like to thank Brattleboro Savings and Loan and Farnham Insulators for sponsoring these forums. During the noon to 1 time slot, we will be switching out the panelists, and we'll be joined by Kirk Woodring of the Brattleboro Retreat, as well as Jocelyn York from Youth Services, Inc. Really appreciate all the great information and conversation we've had with Nicole Miller from the Center for Health and Learning and Ricky Davidson from the Boys and Girls Club of Brattleboro. I don't think we could have assembled a better panel of people to talk about these issues. And Nicole, in the bio that I found on your website, talked about the work that you primarily do on mental health promotion and suicide prevention, and implementing programmatic initiatives of facilitating the Vermont Suicide Prevention Coalition. And Ricky, the work at the Boys and Girls Club, getting you recognized back in 2013 as Youth Worker of the Year by the Vermont Children and Family Council for Prevention Programs. So I think really all the information you've been able to impart today hopefully has been very helpful for the people here in the room as well as the listeners out there, and really appreciate you doing that. Right while we were on the break, Nicole, you were talking a little bit about a couple of high schools, some examples. We've been referring back to this Netflix series, 13 Reasons Why, and a couple of ways that some high schools have leveraged that to the good.
Absolutely. So Burlington High School in particular was really concerned about 13 Reasons Why, and they were recognizing that no resources were provided to anyone that's watching this series. And they actually they did a campaign and were writing Netflix to ask them to give the National Suicide Prevention Hotline before and after every single episode. So I as well will take their lead in sharing, resources that are 24/7. We have a crisis text line, which I think is very accessible, and probably many youth feel more comfortable texting. And you could text VT to 741-741. And that is for any reason of crisis. It doesn't have to in particular be suicide. It's just a crisis text line. So again, that's 741-741, 24 hours a day, 7 days a week. And you could text Vermont. And if you prefer to talk, there is the National Suicide Prevention Hotline, and that's 1-800-273-TALK, 8255. 1-800-273-TALK, 8255.
Yeah, and I mean, I think, you and I also were having this conversation off air about the Center for Health and Learning being located here in Brattleboro. Kind of people aren't aware that this resource is right here in town. So I think it's been great that you've been able to get out there. Are there other things that you've been trying to do to try and push more awareness about the organization in the community?
Thank you very much. Basically, I mean, as I was talking earlier in the conversation, is wanting to get training out to everybody and awareness. And we do offer suicide prevention awareness trainings in the community so that everybody, it's not just the professionals that can recognize risk factors, warning signs, and what to do when you're concerned about somebody, and feel prepared to ask the question, are you thinking about suicide? I want to get you help, and I care about you. So we are offering, trainings throughout the year on many different topics, but this in particular.
Well, you make sure you let us know when the next training is coming up, and we'll make sure that people know about it.
In the fall. Thank you.
All right.
And Ricky, I know now that we are in the summertime season for students here. Probably
things begin to slow down for you now.
Oh yeah, real slow.
So I'm sure a lot of things that you're working on over the summertime to try and keep students positively engaged.
Yeah, I mean, we expand our hours in the summer months at both of our club sites in downtown on Flat Street and in Westgate. at the Westgate Club site as well. We do all-day programs for younger youth, and then for teens, we start at noon every day at Flat Street and go noon to 6, and on Fridays, noon to 11. And from 6 to 11, it's just teens in the building, and it's their time. So we really expand our hours to give them more opportunity to have that connection, to have those conversations. And then we over the course of the whole year, we do a whole series of what we call teen issues movies. And I take Hollywood movie that has an issue to it, and we have a screening time when nothing else is going on in the building, and youth are watching the movie, and then we have a discussion about it, and we have the opportunity to have those talks. So similar to the conversations that we had after 13 Reasons Why, after certain episodes specifically, we would have those conversations. We have this about all kinds of different teen issues throughout the course of the year, which I think for some of our teens has been really helpful and really powerful. Well, even if it's something that they're not dealing with, just to feel like, okay, my friends are dealing with this, and here's some places I can go for help to help them.
I mean, it seems like 13 Reasons Why it's not unique. There's always, in every generation, it seems, some sort of media touchstone. For myself in the 80s, it was Heathers, right? Mm-hmm. I mean, it sparked similar conversations among teenagers of our age group. I don't know how much I'm dating myself by mentioning Heathers. I see people in the room laughing. But it is a similar situation where this is something that is generational. But you need to have these kinds of touchstones in order to continue having the conversation. It needs to relate to them. I'm sure Heather's some of the students today will be looking and go, what kind of corny stuff is that? Whereas the texting and everything that happened in 13 Reasons Why much more applicable to today's conversation.
Definitely, and it really helps to have that conversation starter. I mean, I said that earlier, but really to have that conversation starter, whether you're a parent, a caregiver, somebody in a school, however you have interactions with a young person, to have that conversation starter with them is really helpful.
Yeah.
As much as I'm slightly embarrassed that this is that a series on the television is what brought us here together today. I can think back, as long as we're talking about TV, the after school movies. Do you remember those? Sure. And how they always sort of tapped into these poignant things that might be happening to you, and half the time, I mean, you can only look at Sean Cassidy just so much, right? But and he was always in some sort of turmoil. But nonetheless, it brought you to a point where you could stop and think, hey, that kind of is me. And so I think that on the one hand, the Netflix series 13 Reasons Why did some good. I can definitely see where it can do some harm. I mean, you can almost split it 50-50 down the middle. Of just being able to kind of bring the conversation to the forefront. And I think if it did nothing than just bring us here today, I think that's a positive, and I think we can take that and run with it. Just have the conversation.
And we're running out of time here, but and we obviously are directing the conversations based on things that we've been absorbing and trying to respond to, but what are we missing from this conversation? Granted, I've left us about 120, 180 seconds to fill that in, but when you were thinking about coming and sharing information today, are there things that we've overlooked right now that you think is important for listeners and members here in the audience to hear? They're both shaking their heads, so we did a great job. All right, good job, Fish. Yeah.
Well, and I would just say, as adults that have young people in your lives, be open to having the conversations, and don't be afraid to have those conversations, and don't think that you're putting an idea in somebody's head. I think if nobody walks away with anything else other than that, to have those conversations, to broach those subjects is important. Yeah. And to do that.
And it is hard. As a parent, you've got many different parenting skills. And the last thing that you want to deal with is having a teenager that might be in that dark place. I mean, how terrifying is that for a parent to think that you could have that child living in your house? But how more terrifying is it if you don't address it?
Absolutely. And you don't have to have all the answers. So even if it's calling that 800 number on conference call with your youth and saying, I'm going to sit here with you while we talk to somebody who's trained to talk to you about this, is a step forward.
Right. And I mean, I think just admitting I don't have the answers to any of this. I am out of my depth right now. So we're gonna address this head on. I think it's where just being that person that provides and the parenting begins.
Not being afraid is really important.
It truly is. We want to thank you both for coming in, and I think that might be hearing the conversation repeated a little bit, and I think that that's okay. We want to thank Nicole for giving us new language in the way to talk about this. I think it's important, so we want to thank you, Ricky. Of course, you know how I feel about you and all the hard work that you guys do at the Boys and Girls Club, and just keep on pressing on. And thank you so much.
Thank you for having me.
Thank you. My pleasure to be here.
All right.
We have one more hour to go here of a call to action live from the meeting room at Brooks Memorial Library. If anybody out there in the listening audience wants to come down, we'll be joined in the next hour by Kirk Woodring of the Brattleboro Retreat and Jocelyn York of Youth Services. Ricky and Nicole, you're welcome to stay around as well and contribute to the conversation. We pause now for the top of the hour news break on WKVT 100.3 FM and AM 1490. Chris Lenois and Fish back with you at Brooks Memorial Library for hour number 2 of A Call to Action, our series of public radio forums focusing on critical issues for the greater Brattleboro area. Our topic today has been teen suicide. I thought we had a very terrific dialogue there during the first hour with Nicole Miller of the Center for Health and Learning and Ricky Davidson from the Boys and Girls Club of Brattleboro, as well as some of the members of the community who are here in the audience. And if you want to come down and ask questions or make comments, please do come to the meeting room at Brooks Memorial Library. We're here until 1 o'clock, but by all means also just keep listening at home on the radio, or if you're watching this after it's recorded on Brattleboro Community Television, we appreciate our partnership with them. It'll be available on their cable channels as well as at BrattleboroTV.org. And then we also want to acknowledge again Brattleboro Savings and Loan and Farnham Insulators for sponsoring these call to action forums. It's really been a great series every quarter, Fish, to do this and shed some light on these issues.
Yes, it has. And today, again, it's not it's an issue that comes about from me
watching TV,
binging on Netflix. And although I have to say that I could maybe at most watch 2 of these things before kind of tapping out and just going, okay, I'm going to need a day before I go back into this thing, because it is such a heavy topic. It is so it's impactful. It is such a raw emotional thing that I needed some time to kind of process what I was watching. Now, Jocelyn, have you seen it? Have you?
I actually haven't.
All right.
And actually, none of my clients have ever mentioned it to me, which I know it sounds weird, but it's true. So.
Oh well, no, it's not weird. It's just But okay, so we're done talking to you.
Yeah, right. Well, that's Jocelyn York. She is the Balance and Restorative Justice Coordinator for Youth Services here in Brattleboro. You previously worked at the Brattleboro Retreat.
I did, yes.
In the Tyler 3 unit. But talk a little about now in your work at Youth Services, this topic.
Sure. So what I do at Youth Services is called the Balanced and Restorative Justice Program. And what I do is I provide supportive case management to youth who are on probation, who have serious truancy issues, or who might be at risk of some sort of juvenile justice involvement, so it kind of might be right in that line. I do a lot of work with them where I try to support them as much as I can and try to assess all the parts of their lives that they may be struggling and see how many things we can change and improve, so that once they, especially when they're on probation, once they get off probation, they feel more prepared to get through life and to have access to the resources they need and maybe have more community supports in place than they had before, so that they can go on and be successful, get that record sealed, move into adulthood, and actually move on with their lives as if this was all a bad dream, essentially.
Okay. Interesting.
When you're working with that group, are we talking about a group where this is a subject that is a higher prevalence, a higher risk?
Well, certainly not as high as it was when I worked at the retreat,
sure.
Understandably.
Yeah, that
but
cohort, right.
It's certainly something I come in contact with, as well as the other case management crew at Youth Services who run under the Youth Development Program. They work with the youth shelter, young mothers. They also work with youth who are transitioning out of DCF, trying to get them into adulthood and support them. So among all of us, we certainly see this often. We tend to see them hopefully earlier on when they're not quite as much in crisis as they would be when they get to the retreat. But often we have had to be the ones who sat with them through crisis screenings, visited them in hospitalization, helped get them into some sort of treatment afterward, or be their only actual community support once they do leave hospitalization. So we definitely see kind of more of the wraparound of the before and after. If we're able to get them into treatment and get them out stabilized, which typically we can, we certainly work with either end of that.
Yeah. Now, our other panelist, Kirk Woodring, from the Brattleboro retreat, we mentioned Tyler 3, the adolescent inpatient unit that Jocelyn previously worked at. Obviously, Kirk, the retreat, and you as the chief clinical officer, there's a very big picture view to this topic that you take an approach to.
There is, although I will say we miss Jocelyn and we want
Okay.
her back on top.
This is all a recruiting.
I'm trying to recruit back to the retreat. Yeah, yeah. I mean, you know, the retreat is the de facto state hospital for children and adolescents in Vermont. We treat, children and adolescents from across the region, but for Vermont, it's the one inpatient unit, or the two inpatient units, that children and adolescents who are in crisis end up going to when they're, very suicidal.
Now, I notice you have a book called Assessing the Risk, Suicidal Behavior in the Hospital Environment of Care that you're co-author of. Tell us a little bit about that.
That book really came about from a Joint Commission Sentinel Event Alert. Joint Commission is an accrediting organization that accredits hospitals around the world. And they put out an alert, I guess back in 2010 or 2011, where they were looking at hospital suicides in hospitals, emergency departments particularly, and medical surgical units, and recognizing that staff in those units didn't have a lot of training around assessing for suicide risk. So the book really looks at how to clinically assess for suicide in a rapid manner. Going into an emergency department, how do you ask the right questions to get information about suicide risk from somebody who's coming in, as well as looking at the environment of care, the structure, the building, where are there possibilities for an individual to commit or to cause a suicide to occur. So,
I mean, when we talk about risk factors, are things as a hospital setting, a place where it becomes more acute? I mean, I could see that you're talking about stresses or obviously something happening, a medical episode or some other kind of episode.
Well, people come into the hospital for a variety of reasons, both
Right.
medical hospitals and psychiatric hospitals. But it's quite alarming the number of people that are seeking emergency medical attention, who are also having suicidal thoughts. And certainly when they come to the retreat, we deal with the folks who are the most suicidal of individuals in the community. And so they're the ones that don't feel like they can be safe in the community, that really need a locked inpatient setting to feel secure and to be able to be stabilized. And so it's very evident that people coming in are not necessarily going to stop feeling suicidal as soon as they come into the hospital. And so what we have to do is we have to protect them, often from themselves, by looking at the environment and making sure that there aren't loopables, so areas that we wouldn't want anybody to have a ligature that they could attach to an anchor point. And that's one that's we scan very carefully for that. Making sure that there are no sharp objects. People coming into the hospital, we ask that they leave all their sharp objects with our security staff. And so, there are many ways. Amazingly, I'll walk into any building now and I'm looking at different areas that are concerning
Assessing
to me.
the risk.
So I think Jocelyn probably does the same thing.
Right. Well, and you were both gracious enough to be here for the first hour of this and to listen to Nicole and Ricky and Fish and myself. And I saw, especially Jocelyn, you were taking notes, and you were as well, Kirk. Just some of the things you heard in that first hour, and maybe things that you want to react to as far as what you heard, either things you may not have considered before, although I think with both of your qualifications, maybe you've heard it all before, but maybe things that were reinforced?
Well, I'm interested in the 13 reasons why that, we've talked about. I
You haven't seen it
have
either?
not seen it
Okay.
either. And,
All right.
and it's been really intentional. I've chosen not to to see it. I have family and friends that have watched it, and I've talked with them, and I've read lots of reviews. It's amazing the global reaction to this to this series. I was in Australia actually, and watching the news, and they were having a discussion with a suicide prevention coordinator there about this. So it really has had this global effect. I think part of it is that I don't really like the romanticization of the of suicide. I
think, and if I could interrupt, that was, again, it wasn't so much the series itself that brought us to the table, it was the post-conversation that was going on that brings us here. And I'll just go back and say that anything that can start a conversation around this topic so that it bubbles it to the surface, that it maybe a clue a parent in or an aunt in or a family member, a member of the community in, to recognizing that maybe this child is going through this, maybe this teenager is going through this, I think is a good thing. I happen to agree with you. I think that Hollywood can take it and romanticize it, and the way that the whole series was done from beginning to end makes it look like the person who actually ends her life wins. And we everybody sitting in this room, everybody listening to this knows that is as further from the truth as you can get.
Right. I mean, nobody wins at all with suicide, and I'm the survivor of a family member who died by suicide, and I can tell you that we just never recover from that. Nobody recovers from that, and nobody really understands that. I think that's a one element of suicide that is true even for people who are attempting suicide, is they often don't understand why they're doing that. They may have feelings that they just can't express any other way. It may start as self-harming behavior and develops into more and more lethal attempts. But I think that it's suicide as an area of interest is one that we just don't really understand a lot about.
And Jocelyn, I wanted to give you a chance too to react to what you heard in that first hour.
Sure, yeah. First, just to speak to the show and the media aspect of it, the romanticizing aspect. The thing about this show is that it's not unique. You all spoke about Heather's being something that you watched. Because I watched it when I was a teenager.
Okay.
They put a little more comedy to it, so it makes it look a little more ridiculous. So you can watch it and be in with that idea without the romanticization necessarily. But although I saw it later in years after it had come out, so maybe right when it came out and it was the first time it had really been talked about, it might have been a little different reaction. However, this is not the first time that youth are coming in contact with this kind of stuff. Just as much as when I was in an AP English history or English class in high school, I was assigned The Awakening, where, spoiler alert, sorry if you haven't read it, the woman commits suicide at the end by swimming into the ocean and she feels free. And this is a book we're assigned in school. So, and I don't necessarily think it shouldn't be. It's a really well-written book, and it's written by a woman, which there's not as many of those in school. So I think what's the most important, or one of the most important things I heard, both from Nicole and from Ricky, was that we need to be talking about this. We need to make this not a stigmatized discussion. We need to make sure that youth don't feel like the only way that they hear about this or think about this is in their room with their headphones on watching Netflix, or listening to music, or reading a book in school and then having to talk about it in a school way and having those feelings that they may be having privately or just with their friends who are also having those feelings, who talk about it maybe more in a let's compare notes sort of way than a maybe let's figure out how to not feel this way anymore kind of way. So I think a huge piece is that we need to make sure that we aren't freaking out the second we hear the word suicide, or freaking out the second we hear that a youth is watching or consuming something that has to do with suicide or suicidality. Because it's very normal for this age group particularly to be exploring mortality. For some, it's very serious, and they actually are having these feelings and thinking about this and working on moving toward it, and others are exploring it. And unless you ask questions, unless you have that calm conversation and you keep that open line of communication between the youth you care about and you, or the youth you care about and some provider who's trained to have this conversation, you aren't going to know where they are in that process. and you aren't going to be able to see the signs, and you aren't going to be able to give them the freedom to explore something safely.
Okay. We are going to take a quick break, but the forums are called a call to action. So when we come back from the break, I'm gonna ask you very pointed questions about what do we look for, what do we do, and things like that, so that we can get information. We've had a lot of good information here. It's interesting that our first panel knew what the series, and the second panel is nice. So I think this is good. We'll have an unjaded panel to work with.
I was just
here.
trying to go boy girl.
Yeah, all right.
All I did with the pairings.
But when we return, I'll want to delve into that, and I think we'll be reaching what we're supposed to be reaching here.
Yes, indeed. The forums are called a call to action. The topic today, teen suicide, and we are live at Brooks Memorial Library meeting room until 1 o'clock today, right here on WKVT 100.3 FM and 1490 AM. Welcome back to A Call to Action, our live radio forum series, broadcast live from Brooks Memorial Library meeting room. The topic today that Fish and I are moderating is on the topic of teen suicide. Our panel right now is Kirk Woodring from the Brattleboro Retreat and Jocelyn York of Youth Services. Fish, you kind of set up in that last segment right before we went to the break some of the things that you wanted to do to move us more towards action steps here as we continue through the forum.
So, Kurt, if I could start with you.
Sure.
It's a pretty simple question. If you are a member of society, and I do believe in the whole "it takes a village." I think if we're all watching, I grew up on a city block in Queens, New York, where everybody was extended family. So if you were misbehaving 10 doors down, my mom would get a phone call and she would come down and rectify the situation, or they would just come out and just say, "You kids, knock that off." If we were bullying somebody, if we were doing something, neighbors got involved. I don't think that happens anymore, but it should. So what do we look for?
Well, I think, one of the things that may sound just really simplistic, but I find to be absolutely true, is it's all about the relationship. And so you want to be assessing what's your relationship with the individual that you're working with or know or in contact with. And you really want to be able to engage in conversations with those folks. I think times have changed, and there's not going to be a shout from 10 doors down that you're misbehaving. But monitoring social media is really important, because I think that's where a lot of information goes back and forth. So, if you're a parent or a family member, being able to monitor Facebook, Instagram, and all the other social media sites that exist for teens now is critical. Snapchat, that's important. But I really think that you have to assess what's the relationship like that you have with that person, and engaging in conversation. I think previously there was discussion about there's not this iatrogenic effect of asking a question about suicide and then making the person more suicidal. There's no evidence that occurs. If you are talking to somebody and you ask a question about suicide and they're feeling suicidal, they actually feel a relief about being able to be engaged in a conversation around their own suicidality. So don't be afraid to ask that question. It's fascinating. I work with clinicians who are seasoned clinicians who can't say, "Tell me about your suicidality," or tell me how often you think about suicide. Not, "Are you suicidal?" which is a yes-no question, but tell me about your suicidality, or how often do you think about suicide? It's a hard thing to talk about, and part of it is that people are afraid that if they say it, they're going to create it, and that's just not true.
So here's an odd question. Maybe Jocelyn, you can weigh in on this. So what I'm hearing is like the number one way to avoid this thing is actual asking, stepping outside of your comfort zone and engaging. Can you do that in any way, shape, or form, through an IM on Facebook, through Snapchat, sending a text? "Are you okay? Is there anything I can help with?" Is that acceptable ways of contact to try to, I guess, extract the information out?
Well, that's how I talk to most of my clients, because they don't want to talk to me on the phone, and a lot of them don't want to come have a meeting face-to-face with me, and that's okay. The case managers at Youth Services all have professional Facebook accounts, so that we can have access to Facebook Messenger and things like that, so that we can actually talk to our clients, many of whom don't necessarily have cell phone minutes or access to, they might have more access to Wi-Fi than they do to a phone, various things like that. It's a way they're more comfortable communicating, so they tend to actually say more things and be more open to me if we write it out and just keep writing back and forth than if I call them on the phone or have them sit with me face to face and try to talk about it. So it certainly is, especially in this day and age, and especially with youth, it is acceptable. You certainly want to be physically present in their lives if you can be, because that's a lot of hours to be alone with your thoughts and not have someone physically checking in with you, looking at you. But at the same time, most of my clients who have told me that they're not feeling safe or have asked for help have done so over text messaging. So it's certainly helpful.
So, and if I could just put a bow on that,
Sure.
It doesn't sound like there's any bad way to broach the subject.
Yeah, and
maybe
I'm not
there
sure
is.
that there's. I wouldn't go so far as to say there's no bad way, but I think that I think people should feel comfortable asking the questions, and I think one of the things that you have to be careful about is glorifying suicidality. Not that a parent would necessarily do that, but certainly the thing that's really important is to just take it seriously and not be dismissive of it. I think it's really true for a lot of parents that they don't want to believe that their child may be suicidal, that that somehow is an indictment on them as a parent, and that's not true. Some studies have said that up to 2/3 of teenagers at one time or another will have thoughts about suicide during the time that they're in school. So this is not an unusual thing. I mean, this is actually a normal thing. It's a normative process. I think you talked a little bit, Jocelyn, about some of the challenges of being a teenager and what they're struggling with. And so I think it's normative to have these thoughts, but it's really, really important that parents, guardians, friends have conversations about what those thoughts are. And then to really assess what's the intensity of those thoughts, and how serious are they? Do they have a plan? How long have they been thinking about these? Have they actually tried? Have they made an attempt on their life? And that's when you want to really start to work towards getting referrals and getting the person the help that they need.
I mean, there was a term actually in the email I got from you, Jocelyn, about your bio that I hadn't heard before, and I think it speaks to what you were saying in the previous segment about teens exploring their mortality, but this idea of suicide ideation, is that what you mean by that, when what you were just talking about, Kirk, in terms of these thoughts around people exploring their mortality and maybe processing media in a way?
I think suicidal ideation is a continuum, right? And I think people have fleeting thoughts of suicide, and that isn't unusual. And then, but also if that intensifies, if those thoughts happen more often, if there is an involvement with substance abuse or alcohol use,
Right.
That can vary. That attenuates the intensity of the thoughts, and so those are things that you want to be watching for.
Yeah, I think a big thing about suicidal ideation, and it's more of a clinical term, which is why you haven't heard it. It's more of a differentiation between thinking about it and actually intending to do it, and then actually attempting to do it. So, as Kirk said, it is a continuum. It could be just someone thinking about maybe this would be a good idea, or I wonder what that would be like, or something like that, to the maybe this is the right thing for me, maybe this is the only way, or I really want to do this, or I mean, it could be any of those things, and it just goes back to being able to have these open conversations, not freaking out the second you hear the word suicide and calling the crisis screener, or because people do that, and I understand it.
Yeah.
It's scary. It really is scary to providers, especially to parents, people who may have some level of liability. They say, well, what if I don't do this? What if I don't take this action right now? What if something happens? And I completely understand that fear. I've had it myself with clients and other people I care about, but at the same time, you have to swallow that just for a second and have that calm, open, non-stigmatizing conversation with someone to more than once to understand really where they're coming from and really where their thoughts are and how serious that is.
One of the things that, as I was kind of just researching the topic a little bit more, that I had discovered was that parents tend to then turn that child who was in this suicidal box, and then sort of slowly turn it and make it about them, when it's not about them at all. It's about you helping that person that's in this dark place, and not turning around and putting the blame on you and doing that. Sort that out later on your own time, but it is about that person. Nicole, you're up the mic and you had a question, or
Well, it was actually more of a comment as you were, talking about specifically the reaction whenever you are in this conversation. Just to add, as I totally agree with what you were saying, that reaction is very important, and taking it seriously, not minimizing it, not downplaying it, not telling the youth this will go away, this will pass. I think are all very important things and hard, but for that adult to keep in mind as they're talking to the youth and thinking about how best I can support this youth in that conversation. That's all.
Oh, well, yeah, no, I think it's true. And again, these are not easy questions. So we're not just saying these are like off the cuff things like, how was your school today? And, did you like your lunch? And are you feeling suicidal? These are not off the cuff questions. I mean, obviously you're not going to ask that question every day, but when is it appropriate to ask that question? I mean, what are there telltale signs? Is there something? I mean, do the child come in one day with a light over their head? No, of course they don't.
Right.
I mean,
right. And again, the developmental phase of adolescence is intense all the way around. I mean, there's exploration, there's misunderstanding, there's challenges with communication with peers, with adults, and so it's a really challenging time for folks who are going through that, as all of us have. I think that there are a couple of things. Thomas Joyner, who's a psychologist at University of Florida, has done a lot of research on suicide, and a couple of things that he notes, behaviors or just thoughts that people have are, one is that people feel that they're alone, that they feel isolated, that they have nobody around them that cares. It's not unusual for teenagers to feel that, right? I mean, they often feel isolated and alone. The other is that they feel as if they're a burden. And so that burdensomeness, that sense of I'm causing problems in people's lives, or that almost this kind of worthlessness as a result. Those are two really key areas to be looking at. So are people, are you with somebody, or do you know somebody who's feeling like they're a burden, who's feeling like they're alone? And then when they start to talk about having a desire to die, those three circles, kind of in a Venn diagram, really create this high suicide risk. And so that's what I'm listening to or listening for when I'm talking with teens coming into the retreat, when I'm talking to clinicians about how they listen to stories that clients bring in. Asking those questions to kind of elicit that information is really important.
And as far as community members who are not trained in how to have these conversations and what to do next, you don't have to say, are you feeling suicidal? It doesn't have to be that. Best case scenario, if you have a youth who you are involved with for a long time, whether you're a parent, teacher, friend, whatever you are, if you're able to have open conversations about feelings and about safety and about just generally how their life is going, how they feel about it, what they think about their future, are they having future thoughts, or are those suddenly gone? If you have these conversations regularly with someone you care about, you will know when there's a change. And then you will be better prepared to ask those harder questions, because you will have already had open conversations. You will have already brought up milder versions of this subject with your youth you care about way before you feel like you have to say, are you feeling suicidal? I think that's a huge piece.
Yeah, and I think Nicole said this earlier, paying attention to when somebody begins to not feel joy, to begin to feel like things that were previously enjoyable that they engaged in no longer are interesting to them, or feel like they're engaged in those, whether it's sports, whether it's peer relationships. It's important to be paying attention to that. And I think the way you ask questions is really important. Yes/no questions typically get yes/no responses, right? So asking questions that open up. Sean Shea talks about, he's a psychiatrist in New Hampshire who's written a lot on suicide and on interviewing for suicide, talks about creating a tapestry. So you really want to ask questions that kind of create this map or this tapestry to really give you a good picture of what's happening with a person. So saying things like, when you feel like your grades are slipping and you're noticing that things are not as enjoyable, it's not unusual to maybe have thoughts of suicide. How often do you think of suicide? Or how often are you finding that you're using alcohol? Making these sort of gentle assumptions that things are happening, that if you're asking a yes/no question, you're going to probably get, no, I'm not using alcohol, no, I'm not feeling suicidal.
Right, and it'll bring you, because I don't know in those situations, are you using alcohol? I know how I would have answered that as a 15-year-old, and the answer would have been no, because now that's going to stop any further question around it, because I've already answered it. It's clear and concise, and I could be lying in your face, but there's really nothing you can do. It becomes I think, unless you pull proof or something like that, and then the conversation continues. But I think
if I asked you, or if I said to you, look, Fish, it's the situation that you're in right now, and your peers are drinking. It's really not unusual for you to drink as well. How often do you find that you're drinking? That's probably going to give me a little bit more of a valid response and an honest response, because it destigmatizes the dynamic, right? Whether it's alcohol use or whether it's suicidality.
I'll never forget when there was as growing up as a kid, my parents were really engaged with me, and they would often go out of their way to say, what, we'll always love you. It doesn't matter what you do. We might not like what you do. We may call you out on your behavior, but we will always love you. Know that. When the conversation is done, we will always love you. And it's simple things like that kind of helped me through a lot of things. But my dad would always say things to me like, so what are you doing to make sure you're not drinking with these meatheads? What are you doing? What are the courses that you're taking? And that's not a yes or no question. I'd basically have to go into detail whether I was making it up or not. And then he could tell at that point, okay, and it's, I'm gonna hit the BS buzzer on that one, and let's have a conversation about how your life looks like if you continue down this path. So it was a very engaged conversation. We call them, the closing question that makes you solve your own problem with the guidance of somebody else who has lived through it. Right. So I think it's just important to do that. So
absolutely.
I think one thing parents can do too, and I know this is very, very hard, you want to be the one that your kid comes to with everything. You want to know when they're having a hard time, and unfortunately, a huge number of adolescents do not want to talk to their parents. I don't know if that's surprising to anyone, but they don't, for whatever reason. Even if you're as loving and as open as possible, it just doesn't work for them sometimes. And so being able to, if you have a close family friend who they've grown up with, or that they have a teacher or someone else in their life who's an adult who will not steer them into some dangerous situation, being able to suck up pride or whatever you need to do, or fear to say, it's okay if you talk to this person, and I'm going to give them permission unless something really, really crazy is happening to not tell me what you tell them. Right. Offering that sort of support to your typically adolescent is huge, because that trust level is tough for them with adults. And if they feel like they have someone who knows them, who's grown up with them, who isn't going to judge them, who isn't going to tell their parents when they've been drinking and they feel like their situation isn't safe, or something like that, they're going to be safer.
Yeah, even if the connection is just one chain link removed, it's still a connection.
Yes, it is.
And
yes.
something like
yes.
that. And I think that's great advice. I think we have time to squeeze in one more break here.
Yeah.
And then come back and wrap up this edition of Call to Action live from Brooks Memorial Library, continuing our conversation with Kirk Woodring of the Brattleboro Retreat and Jocelyn York of Youth Services. It's Fish and Chris Back with more on WKVT 100.3 FM and AM 1490. Chris Lenois and Fish back with you on WKVT Radio's A Call to Action live radio forum series. Public forum that takes place in the meeting room at Brooks Memorial Library. We always appreciate them opening this space to us. We appreciate our media partner, Brattleboro Community Television, for coming in and documenting these. You'll be able to see this on their cable channels as well as BrattleboroTV.org. Of course, Brattleboro Savings and Loan and Farnham Insulators for their sponsorship, and absolutely to the panelists who join us each and every time for these topics. We certainly couldn't do it ourselves,
I wouldn't
especially on the topic today of teen suicide. Kirk Woodring of the Brattleboro Retreat in Jocelyn, York, spending the second hour of this forum with us. And we love to pride ourselves in this community on having a lot of resources to address these issues, and that's always one of the goals of these forums, is to bring people together in a room and get people talking about these things. But we can't always compensate for everything, or I'm sure we have some shortcomings, Jocelyn, when we talk about some of the things that we could have more of or that we're missing when we're talking about this issue.
Mm-hmm. Yeah, certainly. We do our work as hard as we can, and we care a ton. And there are community providers. There's not an absence of them in this area. There is the retreat. There is HCRS. There is youth services. There's the Children and Parents Project, which is a community-based mental health provider who is almost always completely full to bursting with clients. We have other community providers who are more single office type situations, but it's just not enough. We don't have enough. Most of our services in Windham County are located in Brattleboro. There's a couple in Bellows Falls, which means that we know Windham County is pretty big, and there's a lot of little towns all over the place, and a lot of people do not have access to transportation, money for gas, various things like that. They cannot get to providers. They cannot get the help they need because there's no one who's able to go to them and offer the help. We need more community providers. We need more clinicians who are willing to do home visits, things like that. I know it's hard. I know the model is typically to meet in an office, and that is safer, and I can't blame anyone for feeling the need to have that be the way their practice is, but we need more people who are willing to go to homes and go into the community. I'm sure Kirk can speak to this, so I'll let him, but the retreat needs more funding.
Thank you. You're
the
right, we do.
hospitals are overloaded. The emergency departments are overflowing with mental health crisis patients who should have their own space, not a medical space. The medical patients should have their own space that they're not having. Mental health patients are waiting in the emergency department for, if they're lucky, a few days. Some have waited months in the emergency room for a bed at the retreat because there's nothing. That is unacceptable. It should not be happening. I've heard time and time again that our government prides itself in doing right by Vermonters with mental health, and I want them to do better. They can do better, and they should do better. And that starts with approving funding for mental health, more funding for social workers within the retreat and outside of it, funding for remodeling, funding for more smaller units that are regional so that families can visit their children. We have people from Newport who cannot see their children for months because they're in the retreat down here in Brattleboro, and that's just not right. So those sorts of things are huge. What the community can do, call your representatives, call the State House. We're lucky enough to live in a state where you actually can call the State House and talk to somebody. That doesn't happen in every state.
No, it's true.
Do that, please. If you feel like this is too big to deal with on your own, you're right. This is too big to deal with on your own. The community and the small amount of providers that are in the community cannot shoulder the burden of specifically things like suicide. We need more help. We need more supports. We need more wraparound services that go into the homes, that follow from the hospitals to the communities, and we just don't have it. So that's my big spiel.
Well, I know lawmakers in this last session were looking, especially around the issue of compensation for mental health workers, which obviously when you're talking about recruiting and retaining some of the workers here, a big issue. And some of the things you mentioned there, especially about outreach, Kirk, I know when we've done previous forums about substance abuse and when we've done previous forums here about mental health in general, and we've had other folks on the retreat on. This has been part of the goal. You've been doing more outreach, partnering with groups like Groundworks Collaborative on
Right.
some of these issues.
Yeah. I mean, we're doing what we can in terms of reaching out and being good members of the community, I think. And I think the community has been very supportive of the retreat over the years, but I do think that the mental health system is broken. Dr. Josephson, who's our CEO, has said that. I agree with him. It's not just Vermont. It's across the country, but Vermont particularly has a real crisis in terms of mental health right now and mental health services and coverage. It's a rural state. We know that in rural states the occurrences of suicides are much greater for a variety of reasons. We're in the Northeast. It's darker, half the year. We're heading on that trend right now, right? The days are getting shorter, and we have a real epidemic around substance use, particularly opioids. All of those lead to risk factors for increasing suicide. If we don't have the services available, then people who are feeling pain are going to not be able to manage that pain and are going to end up probably becoming more suicidal over time. One of the things I say often when I'm doing talks about suicide is that people become suicidal when the intensity of the pain that they experience exceeds the capacity of the resources available to help them manage that pain. So if we don't have resources in the community to manage the pain that people feel, and the mental health needs that they have, and the substance abuse needs they have, then we're doing a disservice to the entire community and to those individuals who are in pain. So I agree with Jocelyn in terms of the funding. We're the only hospital in the state that takes children and adolescents, and we only have right now there are 16 beds on Tyler 3, which is our adolescent unit.
And it's the only one in the state.
It's the only one in the state. We have 12 beds for our children. I mean, we serve children ages 5 to 12 on that unit. And so when we're the only one in the state, and actually really one of the few in the region across New England, then that says something about the lack of resources available. And we're not a state hospital. I mean, we don't get funding from the state specifically for child and adolescent services on an inpatient level. It's through insurances. So we're not getting a stipend to have a hospital beds held open for children and adolescents in Vermont.
Well, you're actually a nonprofit.
We are.
So, and people don't understand, and it seems crazy because when you think of hospitals, you think, well, an MRI costs $2,500. I mean, we're going towards the medical side, but that's not true. Even Brattleboro Memorial Hospital is a nonprofit. This is the way, this is the system, and as you both have alluded to, the system is a little bit, maybe a lot, broken.
Yeah, absolutely. And we would never want to be a for-profit hospital because the care that for-profit hospitals give, especially in psychiatry, pretty abysmal. I mean, if you look at Massachusetts right now, there's a for-profit hospital association that runs about 2/3 of the hospital beds, psychiatric beds in Massachusetts, and the care that's given is really, really poor. And we would never. Their profit margins. I mean, their profit margin is like 24%. Ours is we have maybe if we're lucky, budgeted for a 2% profit margin. It's probably not going to happen. Last year we lost money. We'll probably will again this year. So we're in it to take care of people, not to make money, but we need support from the community and from the State House.
And speaking to that as well, the retreat tends to have to hold adolescents and children longer sometimes than they need to be held. Because there are not what we call step-down units in this area, where basically someone who's mostly stabilized or completely stabilized but still needs a lot of support and a lot of consistent day-to-day care, they have nowhere to go after that. They have to go to a residential treatment unit, which is just not quite enough, or they have to go home. Right. And I know parents whose children have attempted suicide, and they have to take this child home from the most locked down they could be to their house, where they're scrambling around trying to clean up, trying to look for everything, lock up all the medication. They have to go to work. Who's going to watch them? the retreat's looking at them, asking for their help, saying, okay, here's the safety plan, here's what we're going to do, can you handle this? Of course the parents can't handle it. They want to be able to, but they can't. And there's no place in between, really, for their child to go. And
that has been a thing in the medical world, I know, following a patient after they are discharged.
Yes.
It sounds to me, and I mean, one thing I keep taking away from all of these forums we do more and more is we need to stop looking at physical health and mental health as these separate tracks of things. Obviously, there's a lot of ways that they intersect, but that opportunity, resources to follow patients after they leave seems to be severely lacking as well.
Absolutely. I mean, we have a mandate to be able to get people in for services when they discharge from the retreat. And to get an adolescent to see a psychiatrist easily can take 3 to 4 months, easily. I mean, that's in the best situations. I mean, if you've got somebody who's living in a very rural community that doesn't have access to those resources, it's just not going to happen that they're going to see a prescriber. And that's really important. So we're sending people out in the community that they may be waiting 3 to 4 months to get the medication that they need, and it may be prescribed by their primary care clinician who isn't necessarily trained in psychiatry.
Right, they get stabilized on the medication that the retreat has worked so hard to figure out for them so that they can go into the community and be stable. And a lot of times it drops off almost immediately after they leave. They have a certain amount they're sent away with, and then that's it. And they can't get in and get a prescription for more, or their insurance only covers it while they're at the retreat. It doesn't cover what they're given once they leave.
So here's a promise I'll make to the both of you. Once I have a bottomless pit of money, I'm going to begin to sue the insurance company for practicing medicine without a license. All right. So that is the one thing, because it does seem like that is a big funding has always been a big problem. Resources come because funding is there to provide those resources, and these are the things that we need to take a look at, especially when we are talking about such critical things as suicide and teen suicide and youth suicide. And thank you for all the work that you both do on that front. It's can't be easy, and we appreciate that you were there, and we want to thank you for coming out today.
Thank you.
Thank you for having us. Yeah.
We want to also, since we are talking about teen suicide again, talking about texting. If you text VT to 741-741, that is the free and confidential 24/7 crisis text line. We appreciate Nicole Miller of the Center for Health and Learning bringing us that information. She was part of the panel with Ricky Davidson of the Boys and Girls Club of Brattleboro for the first hour. Kirk Woodring of the Brattleboro Retreat, Jocelyn York of Youth Services, thank you so much for being here for the entire panel and all your contributions here during the second hour. And
thank you.
Appreciate Fish, the co-moderator with me on these forums. Linda Steele back in the studio operating the board. Brattleboro Community Television as a media partner here. You'll be seeing this on their cable channels as well as BrattleboroTV.org. And thanks again to Brooks Memorial Library for hosting, Brattleboro Savings and Loan Farnham Insulator for their sponsorship. WKVT Radio 100.3 FM and AM 1490 goes back to its regularly scheduled programming.